My name is Nikolaus Pfisterer. I'm working as a gastroenterologist at the Klinik Landstraße, working in the 4th Medical Department here in Vienna, Austria. I would like to present a study that we recently published in Gastrointestinal Endoscopy, in which we examined the outcomes of patients with cirrhosis who experienced acute variceal bleeding over 22 years, focusing on recurrent bleeding, short-term mortality, and associated risk factors. Liver cirrhosis is one of the leading global causes of death. Serious complications like ascites, acute variceal bleeding are primarily driven by portal hypertension. Although treatment guidelines exist, real-world adherence is often suboptimal. Moreover, up-to-date outcome data after variceal bleeding are limited. So in this multi-center cohort study, we aim to close this gap by analyzing trends in recurrent variceal bleeding, bleeding-related mortality, and associated risk factors over a 22-year period. We included 406 patients with liver cirrhosis and acute variceal bleeding treated at 2 large Viennese liver centers. From 2000 to 2009, 237 patients underwent endoscopic procedures during variceal bleeding. From 2010 to 2022, 169 patients were finally included. We compared outcomes between these 2 decades, focusing on 6-week recurrent bleeding, bleeding-related mortality, and 1-year overall mortality. Between 2000 and 2009, patients with acute variceal bleeding between 2010 and 2022 had significantly fewer 6-week recurrent bleeding episodes than patients with acute variceal bleeding between 2000 and 2009. From 90.4% to 11.8% significantly. We found that the 1-year mortality dropped from 34.2% to 26.6%. So we clearly observed improved outcomes over time, especially fewer early rebleeding events and lower 1-year mortality rates. In our mortality analysis, 2 key findings stood out. First, a higher Child-Pugh score was a strong factor both for 6-week recurrent bleeding and 1-year mortality. And the second, the use of non-selective beta blockers was an independent protective factor for 1-year mortality. So what are the potential drivers for this improvement? The key improvements in acute variceal bleeding management were guided by the Baveno consensus guidelines, which recommended the endoscopic band ligation and the non-selective beta blockers for secondary prophylaxis. Vasoactive medication antibiotic prophylaxis to reduce infections and mortality, and since 2013, a restrictive transfusion strategy. These interventions likely contributed to better outcomes in the past decade. Our current study confirms this again. Beta blockers use was an independent protective factor for 1-year survival, consistent with early findings.